So here's a recent headline that got my attention. A study by the University of Pittsburgh and UPMC Hillman Cancer Center suggests that a popular sugar substitute for people who may be cutting calories or managing blood sugar levels could make immunotherapy less effective. The researchers found that patients with melanoma and non-small cell lung cancer who also consumed high levels of sucralose had worse responses to immunotherapy and poorer survival than those with diets low in sweetener. Sucralose is also commonly known as Splenda, the yellow stuff. Many people use Splenda to sweeten their coffee and their tea. It can also be found in things like soda, yogurt, gum, and some baked goods. So should this be cause for alarm for cancer patients that are undergoing immunotherapy? Well, the same team also discovered that supplements that boost levels of the amino acid arginine, which helps the body to build protein, mitigated the negative effects of sucralose on the immunotherapy in mice. Abby Overacre, who is a professor that worked on the study, said it's easy to say stop drinking diet soda, but when patients are being treated for cancer, they're already dealing with enough. So asking them to drastically change their diet might not be realistic. She said we need to meet the patients where they are, and that's why it's exciting that they discovered this arginine supplementation, which could be a simple approach to counteract the negative effects of sucralose on immunotherapy. She goes on to say that these observations raise the possibility of designing possible prebiotics, such as targeted nutrient supplementation for patients who consume high levels of sucrose and are getting ready to go through immunotherapy. The researchers went on to ask what is considered a high level of sucrose, and Overacre explained that it was quite surprising to find that even very low levels of sucralose, 0.16 milligrams per day, were enough to worsen the response of immunotherapy for cancer patients. So these results have prompted the researchers to go forward and do some future studies where they look at other sugar substitutes like aspartame, saccharin, xylitol, and stevia, and their impact on the immune system and the response to immunotherapy. So again, as a bladder cancer patient, this got me interested because it talked about the effects on immunotherapy, which is something that many bladder cancer patients go through. I think a lot of these results are very early on. They only studied 2 kinds of cancer. They only studied 1 sweetener. So obviously it'll be interesting to watch this study go forward and see what results come from other artificial sweeteners. But as a bladder cancer patient, I do think it's important to take stock of the things that we are ingesting. My own doctor suspects that my cancer was caused by toxins that I was ingesting. Before I was diagnosed, I drank lots of energy drinks and diet drinks that had artificial sweeteners and other chemicals that I can't even pronounce the names of in them. And since my diagnosis, I've cut out many of those things. Actually, the only sweetener that I use now is stevia in my coffee, because from what I've read, it seems to be a rather natural sweetener. But other than that, I'm pretty much a coffee and water guy. And I like to squeeze a little lime in my water. So what about you out there? Have you done anything to eliminate toxins and artificial sweeteners from your diets? I'm curious to know.